Hello everyone, and in this video we are going to be introducing the medical ethics principles. And so there's four of them that you need to know, and they are the following. So we've got autonomy, we've got beneficence, we've got non-maleficence, and finally we have justice. And so to dive right into this, autonomy is the notion that patients should have their decisions respected. So if a doctor just went to a patient, they gave them a diagnosis, the patient said, the treatment plans that you're giving me, I don't want to be treated because I don't think the benefits outweigh the risks here. The doctor should respect that patient's wishes because the doctor is assuming that the patient has autonomy. So that is respecting the autonomy. So that is that first principle that we turn to. The next one is beneficence. And so by the principle of beneficence, when a patient sees a doctor, you're going to assume as a patient that that doctor is going to do the most good. They are going to make sure that they've got an accurate diagnosis, and based on that diagnosis and all the information that they have, they're going to do the best job they can of finding you the most appropriate and effective treatment for that particular diagnosis. Like, that's why the doctor went to med school and why they did all this training, is to make sure that they understand the nuances of these situations, and you're assuming that that doctor will act in your best interest following beneficence. And so the next thing here is non-maleficence. And so in non-maleficence, what this means is that the doctor is not going to do something that will intentionally cause harm. And to give an example of a real story where this happened is a drunk driver just killed a family, and the drunk driver was injured in this car accident. And so they were brought to the hospital, the ER. And so in the ER, a lot of people know that this guy just killed all these people and they really don't like him. And so, some of the nurses or a doctor says, we can use a bigger gauge needle to administer this IV to cause this guy more harm because he just did all these terrible things. And so by acting in a non-maleficent way, by acting in that principle, you're saying, no, we're going to treat this patient the way we would treat anybody else. We are not going to go out of our way to cause harm. Another example of non-maleficence is one in which a doctor is prescribing a medication that isn't necessary. So a doctor is saying, we're going to do chemotherapy to someone who doesn't even have cancer, and we're going to make you go through all these terrible side effects. That's acting in a way that causes harm. So that is violating that principle of non-maleficence. And finally, what we have is the idea of justice. And so basically justice is the principle that says that every patient should be treated fairly and equitably. And so an example of injustice is one in which, let's say you had a waiting room of 4 people and they've all been there for at least 30 minutes, but then you have this other patient step into this waiting room, and because this patient is the son of a doctor and this doctor knows the other doctor who runs this practice, that patient who just came in gets moved up to the front of the line and seen immediately. That is an example of patients not being treated equitably and fairly. And so that is what injustice looks like. Justice would look like where patient 1 comes in for their appointment and patient 2 comes in for their appointment, and because the first patient came in first, they're seen first, they're treated the same. And this is obviously reducing the effect of any confounding variables, where if you're in an ER and one of the patients has a more life-threatening disease, you're going to need to see that patient first, even though maybe a patient showed up before that one, so during triage. And then finally, I'll wrap this up with a little example that I think does a pretty good job of hitting this story home, which is, let's say you just had a huge accident and you've been rushed into the ER and the doctors just remove your spleen. They've done a splenectomy. And so what ethical principle have they just followed in doing this? Because they obviously didn't ask for your permission to do this, so it's not autonomy. But what it is going to be called beneficence. And the reason it's called beneficence is because these doctors are acting in your best interests. They know that you need to get that spleen removed because otherwise you're going to die, you're going to have really bad outcomes. And so because of that, the doctors are acting in the best interest based on the diagnosis that they have. They're doing the most appropriate treatment plan for that specific case, even though they can't necessarily check with your autonomy. An example of non-maleficence would be the doctors. So violating that non-maleficence would be if the doctors decided to give you some drug that had nothing to do with, helping with this, disease that you just presented with, but instead made things worse. So that would be a violation of non-maleficence. And then injustice would be one in which, in that ER, even though you had this really life-threatening disease, because one of the patients was, a son's CEO with all these well-placed connections, that person gets seen before you, even though you really needed that medical treatment immediately. And so that is how injustice would look. So I hope this is helpful. Thank you all for watching. Let me know if you have any questions, and I hope everyone's doing well. I'll talk to you guys next time.